10 warning signs of colon cancer you shouldn't ignore. Colon cancer or colorectal cancer starts in the large intestine or in the rectum. It is treatable when caught early, but it's still the third most common type of cancer in men and women in the United States. Most colorectal cancers begin in cells that make and release mucus and other fluids, causing a tumor to form in the lining of the large intestine. People often ignore the warning signs of colon cancer until the problem becomes severe. It is important to be aware of these signs, as addressing the problem early can save you from future complications. As it can be difficult to treat colon cancer after it spreads to nearby areas, it is important to know what the early symptoms are. This can help you seek early treatment and give you a better chance in recovery. If you have multiple signs and symptoms of colon cancer, ask your doctor to check your health levels and get the best treatment for colon cancer. Here are the early warning signs of colon cancer. 1. Constipation. Constipation is an important sign of cancer in the colon. A 2011 study published in the Asian Pacific Journal of Cancer Prevention highlights the link between constipation and colorectal cancer risk. An earlier 2004 study published in the European Journal of Cancer supported the hypothesis that constipation or laxative use increases the risk of colon cancer. A tumor present at the far end of the colon can make it very difficult to eliminate waste products, thereby causing constipation. If you persistently have fewer bowel movements per week, without any prior problem of constipation, consult your doctor to find out the exact cause. 2. Diarrhea. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. If you suffer from diarrhea for more than a couple of weeks, it may be an early symptom of colon cancer. When a tumor partially obstructs the bowel, it can cause alternating constipation and diarrhea due to leakage of liquid stool. You may also experience frequent gas, abdominal pain, nausea and vomiting. Plus, a tumor may irritate or narrow the lining of the intestine. It is important to consult your doctor when you have diarrhea that lasts more than a few days, as it can lead to dehydration, drain your body of nutrients and signal other serious problems, such as cancer. 3. Blood in stools. Most often, blood in the stool is due to piles, hemorrhoids, where the veins in the back passage become fragile and cause a little bleeding during a bowel movement. This type of bleeding is generally red. However, if you notice dark red or black blood in your stool, it can be a sign of cancer, such as bowel, rectal or colon cancer. It can also be due to a stomach ulcer. Whether bleeding is due to piles, a stomach ulcer or cancer, it's important to get it checked by a doctor. Proper diagnosis is essential for appropriate treatment. 4. Constant feeling of a bowel movement. If you have a constant feeling of urgently needing to have a bowel movement or to strain but no stool is passed, it is not a good sign. This feeling can occur even after having a bowel movement. Changes in your pattern of bowel movements can be a sign of colon cancer. It can occur when a tumor blocks the bowel and prevents you from completely emptying your bowels. If you persistently have the sensation of incomplete evacuation after a bowel movement, discuss the problem with your doctor. 5. Narrow stools. Thin, narrow stools are also a warning of possible colon cancer. A tumor present in the left side of the colon obstructs the passageway and often leads to narrow stools. Do not delay discussing any change in your stools with your doctor. Diverticulitis and anal cancer can also cause narrowing of the stools. 6. Tender abdomen or abdominal pain. If your abdomen, especially the lower part, hurts or feels tender when touched, this can be an early indication of tumor growth in the digestive tract, colon or rectum. In fact, abdominal pain is common in people who are later diagnosed with colon cancer. A tumor can cause a block in the colon, restricting blood flow. This leads to abdominal pain that can be severe. This pain also can indicate that the cancer has begun to spread to other organs. If abdominal pain or tenderness persists for more than 2 to 3 days, consult your doctor for proper diagnosis. 7. Unexplained anemia. Anemia refers to a low red blood cell count in the body. The hemoglobin in red blood cells carries oxygen throughout the body. Symptoms of anemia, such as pale skin, a fast or irregular heartbeat, shortness of breath, dizziness, and cold hands and feet, should not be taken lightly. Unexplained anemia may be due to colon cancer. Typically, cancer in the right side of the colon causes iron deficiency anemia. This happens when tumors start bleeding slowly into the digestive tract, causing blood loss over time. A 2008 study published in the British Journal of Cancer confirms a strong connection between anemia and cancer, with the risk rising as the hemoglobin level falls. The study also confirms iron deficiency as an independent predictor of cancer. If you have signs of anemia, consult your doctor immediately to get your hemoglobin level checked. 8. Unexplained weight loss. If you are above the age of 50 and rapidly losing weight without any known reason, it is a cause for concern. Sudden, unexplained weight loss can indicate a serious health problem, including colon or rectal cancer. A 2006 study published in the Annals of the Royal College of Surgeons of England found that unexplained weight loss happens mostly during advanced stages of colorectal cancers. The growth of a tumor can lead to loss of appetite, as cancer can affect your metabolism, thus causing weight loss. If you are rapidly losing weight without changing your diet or exercise routine, discuss this with your doctor. 9. Weakness and fatigue. Another early symptom of colon cancer is fatigue, weakness and general malaise. Fatigue and tiredness after doing a laborious task is to be expected, but if you feel tired and weak most of the time, despite resting, do not take it lightly. Large polyps or tumors in the colon can lead to iron deficiency anemia that causes lower oxygen levels in the blood. This contributes to fatigue. Fatigue and weakness can also be related to a number of chronic illnesses and medical disorders, so visit your doctor to find out the exact cause. 10. Gas and bloating. Most people suffer from gas and bloating occasionally, but if the problem occurs along with some of the other symptoms mentioned here, it may be an indication of a tumor growing in the colon. A tumor causes obstruction in the colon. Depending on the severity of the blockage, gas, solid and liquid may be prevented from passing out of the body. This in turn causes progressive bloating as well as gas. If you have a lot of discomfort due to gas and bloating, see a doctor to rule out the possibility of cancer. Please note, the content provided below and elsewhere on this video is not intended nor should it be construed as providing professional medical or nutritional advice. Do not rely on information provided on this video for your health problems. Instead, consult a qualified medical professional for advice. Colon cancer treatment with natural herbs. A diagnosis of cancer is never the news a patient wants to hear. Colon or colorectal cancer, in particular, is considered the third most common cancer in America. While you cannot control hereditary and some environmental factors, you can still lower your risk of cancer by making healthy diet and lifestyle choices. A well-planned diet can help prevent many cancers. Here's a list of some of the best foods and herbs to eat if your goal is to prevent and cure colon cancer. 1. Broccoli. Thanks to the nutritional value of broccoli, this cruciferous vegetable may be one of the best foods you can eat if you want to reduce your risk of colon cancer. Broccoli contains virtually zero fat and ranks low on the glycemic index. It is a great source of carotenoids and vitamin C, and it also contains some vitamin E. Further, broccoli is one of the best dairy-free sources of calcium. Last but not least, broccoli is a great source of indoles, natural compounds that are believed to inhibit cell proliferation of colon cancer cells. To get the most out of broccoli's health benefits, choose organically grown plants. 2. Barley. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. The dietary fiber in barley increases bulk, softens stool, and shortens the transit time of fecal matter, thereby decreasing the risk of colon cancer. In addition, barley's fiber feeds the friendly bacteria in the large intestine, helping these bacteria to produce a short-chain fatty acid called butyric acid, which helps maintain a healthy gut and prevent colon cancer. What's more, barley is loaded with selenium, with a mere cup of cooked barley containing more than 50% of the daily value for this trace mineral. A sufficient intake of selenium can greatly reduce your risk of developing colon cancer. Whole grain or hulled barley, the most fiber-rich and nutrient-dense type, is still relatively difficult to find in regular shops, but it is readily available through online vendors, such as these ones. 3. Beets. Munching on red beets is a great way to reduce your risk of colon cancer. The fiber found in abundance in beetroots reduces the time the stool spends in the intestines, thereby limiting the colon's exposure to potential carcinogens. Also, the green leafy tops of beets are edible and high in fiber, so don't throw them away. They can be cooked like spinach. In addition, several studies have shown that phytocyanin, a phytochemical compound responsible for beets' intense purple color, is highly effective at fighting cancer, particularly colon cancer. To maximize beets' cancer-fighting properties, cook them only lightly. Research suggests their anti-cancer activity is reduced by heat. 4. Organic red peppers. Red peppers contain plenty of carotenoids, including beta-carotene and lycopene, which may help reduce the risk of colon cancer. But that's hardly their only colon cancer-fighting feature. Red peppers are also a good source of N-acetylcysteine, NAC, a natural compound that has been found to have anti-cancer properties. A preliminary double-blind, placebo-controlled study with 62 participants, each of whom had had a colon polyp removed, found that those individuals who were given 800 mg NAC daily had more normal cells in the biopsied rectum tissue than those in the placebo group. In addition to carotenoids and NAC, bell peppers contain some folate. When buying peppers, it is important to choose organically grown produce, as conventionally grown peppers are at the top of the list of vegetables that contain the highest levels of pesticides and other harmful chemicals. 5. Blueberries. Blueberries contain pterostilbene, an extraordinary colon cancer combating compound. Blueberries are one of the greatest health foods of all time and a great anti-cancer food. One animal study found that a compound called pterostilbene in blueberries can help prevent colon cancer. In this study, 9 rats with colon cancer consumed a balanced diet including pterostilbene, and another group of 9 rats with colon cancer were fed a balanced diet with no pterostilbene. After the 8-week study period, the group who received the blueberry extract had 57% fewer precancerous lesions in the colon compared to the control group. Also, in vitro studies have found blueberries to be effective at inhibiting colon cancer cell proliferation and inducing cancer cell apoptosis.